Right, hello everybody. Thank you for joining us for one of our Digital Info Day sessions. My name's Fern and I'm one of the myeloma information specialists at Myeloma UK. So I work on the info line and also the Ask the Nurse email service. Before we begin our event, I'm just going to go over how the session's going to work. We'll be recording this and it will be available to watch on our Facebook page and on our website soon after. If you have any questions, please just use the Q&A box at the top or the bottom of your screen, and we'll try and get through as many of your questions as we can. Some of you might not be familiar with our organisation, so I'm just going to tell you briefly about who we are and what we do. Myeloma UK exists to support all those affected by myeloma and its related conditions, which include smoldering myeloma, MGUS, and ALL amyloidosis. We are patient focused and we aim to empower, inform, and support our patients in everything that we do. As an organisation, we rely on the generosity and the kindness of supporters who fundraise and donate. Myeloma UK is a charity solely funded by our supporters. We receive no funding at all from the NHS or the government, and everything that we do is funded by voluntary contributions, fundraising, and gifts left in wills. We're truly thankful for all of your contributions as they allow us to continue working to help patients, their families, and their friends and put on events like this one. So tonight's digital event is on the topic of travelling with myeloma. Rhys Owens, our Senior Clinical Practice Officer at Myeloma UK, will be talking about how you can safely travel when you have myeloma. So let's get started. I'd like to hand over to Rhys, who's going to give you a brief overview of the service and his role.
That's great. Thank you, Fern, and good evening, everyone. My name's Rhys and I work for the clinical practice team here at Myeloma UK. And as Fern mentioned, I will be presenting a few slides on travelling with myeloma, what to consider when you're planning your travel, and tips for travelling safely as well. So, three take-home messages from today. You can still enjoy travelling when you have myeloma, however, it does require some extra planning. Travel insurance is essential and may require some shopping around to get the best deal. And last but very much not least, your travel should focus on visiting people and places that uplift you and you return feeling well rested. So the talk today will cover travelling in the UK and abroad. We'll talk about travel insurance as well and tips for travelling safely. So some myeloma patients may feel more comfortable traveling within the UK as it is more manageable than going abroad. You can access health across the UK wherever you go, and it may be possible to arrange some treatments or blood tests at other UK hospitals that are near your hospital destination. All of that will need to be discussed with your healthcare team before you travel. However, traveling abroad is still very much possible with myeloma. This is a quote from a myeloma patient, and they say, "You can still travel the world with myeloma, albeit with a suitcase full of drugs." And the idea of traveling abroad with myeloma can feel quite scary or daunting at times. And there's certainly more to think about when you're traveling. Things like travel insurance, making sure you've got the right documents at hand, sorting out your medicines, your vaccines, knowing what the local healthcare services are in your travel destination, as well as special assistance when you're getting to your destination and from your destination as well. So there can be a lot to think about, but it is certainly possible. It just may need a bit of extra time, planning and preparation. So we'll touch on all of these later on in the slide set. So speaking to your health team is very important to do before you book, just to confirm the treatment dates and if there's any gaps, and whether it's fit for you to travel. Occasionally, teams can change the treatment dates by a couple of days to allow for that travel to happen, although that needs to be discussed with your healthcare team before you go. Are you fit to fly? So this is again a good question to ask your healthcare team, and some travel insurers and airlines do require a letter from your healthcare professional to confirm this. And vaccine advice as well is really important. So to take a list of your vaccines that you need for your destination and ask for advice from your healthcare team. After booking the holiday, there's a couple of pieces of documentation that you need. If you have controlled drugs such as morphine, you'll need a prescription copy or a letter for that. You'll also need a letter detailing your treatment history and myeloma information. So that's if you were to fall ill in your holiday destination, then the team treating you in that destination have an idea of what treatments you've had as well as your medical history. Another thing to ask your healthcare team is whether you should take antibiotics with you just in case, as well. And we'll touch on that a bit later, and blood clot prevention advice as well. So just a little bit about vaccines. So they boost the body's immune system to help protect you against specific infections. A vaccine is made from a weakened or harmless version of a virus or bacteria it's been designed to protect you from. There are a class of vaccines called live vaccines, which contain live viruses or bacteria, and it's generally recommended that myeloma patients do not have these vaccines, as the immune system might not be able to handle the small amounts of virus or bacteria in the vaccine. And this could lead to you getting the illness the vaccine is meant to protect you from. So that might mean that you need to change your travel plans. So it's important to research your destination before you go and see what vaccines are needed. It's also important to allow a few months to arrange these vaccines, as some need to be given a few weeks prior to you going on holiday as well. So it's important to speak to healthcare teams about vaccine advice that's specific to you. Taking medicines abroad. So the country you're traveling to may have medicine restrictions, particularly for controlled drugs such as morphine, and you can check these restrictions via the embassy, Home Office, or High Commission. So it's important to check what restrictions are specific to where you're traveling to. You'll need to have enough medicines to last the trip, plus some extra just in case your flight back to the UK is delayed or cancelled, so that you can be tied over for the rest of your time at your destination. It's important to pack medicines in your hand luggage as well in their original box or packaging, and just to take just in case medicines as well, things like painkillers or medications for constipation or diarrhea. So even if you haven't had these symptoms for a long time at home, things may change on holiday, and having those just in case medicines for some of those symptoms are really important. And lastly, to check your accommodation at your destination to make sure that there's fridge availability if you have medicines that need to be stored in a fridge. So accessing healthcare abroad, it's really important that you research your destination before you go, know where the hospital is and how to access healthcare facilities there, and to save the important information in advance to either store it on your phone as a note or to put it on a piece of paper that you carry around with you just so you've got that information on hand if you need it. The global health insurance card is also something worth considering. So some countries in Europe have a joint health agreement with the UK, and it entitles UK residents to access state-provided healthcare in these countries. So it means that you can have healthcare at a reduced cost or sometimes for free. It's worth pointing out at this point that this card won't cover costs of private medical costs, and it won't cover the cost of you getting back to the UK should you become unwell on holiday. So it's still important to get travel insurance as well as the card. You can also, if you're having any planned treatments abroad, you can apply for funding through the S2 funding route, and that entitles you to have state-funded treatment in EU countries. And the treatment provided is under the same conditions of care and payment as the residents of that country would get. So this can mean you could have to pay you'd have to pay a percentage of the costs personally. So it's possible to arrange some infusion and injections abroad, and speaking to your healthcare team about that funding route is the best way to go for that. A little bit about infection risk. So people with myeloma often have a weaker immune system, so more at risk of infection. Ask your healthcare team about taking antibiotics with you. It's very much a individual kind of decision, as different people have different infection risks. So it's definitely worth asking your healthcare team if it would be best for you to take some antibiotics just in case you become unwell whilst you're traveling. Wearing a face mask as well, particularly in busy areas and on public transport, keeping hand sanitizer with you and applying that as often as you can, and to consider avoiding large crowds as well. So busy public transport or visiting tourist areas during peak times might be better to go at a slightly quieter time of the day, just to reduce the risk of catching illnesses from others. A little bit about sun safety. So some myeloma treatments mean that your skin is more sensitive to sun damage. So it's really important to apply sunscreen with SPF 30 or above regularly and generously. Also important to stay in the shade and avoid the sun between 11 a.m. and 3 p.m. Wearing loose cotton or linen clothing that covers your skin, and wearing a hat as well. So general sun safety tips there, very, very relevant to myeloma as well. Some tips for flying. So important to keep hydrated and consider to wear kind of socks or compression stockings, as well as moving your legs regularly and walking up and down the aisle. And important to ask your healthcare team about any blood thinning medicines that might be right for you, as flying does increase your risk of getting blood clots as well. Other tips include booking a seat near a toilet if you need to use that frequently, and to consider special assistance such as wheelchair assistance, help getting through security or check-in, or help getting on or off the plane as well. So a little bit about travel insurance. So it's really important that you contact the insurance companies well before you travel. And before booking a trip, you may need to contact several companies to get the best deal. Whenever possible, it's important to speak to someone on the phone, just because it gives you more opportunity to explain your individual situation. They might be asking quite a lot of detailed questions about your health and treatment, things like if your myeloma is terminal and what stage it's at. But given the nature of myeloma being a relapsing, remitting cancer and not being staged like a typical cancer, it can be difficult to express that on the online forms that you fill out to get a quote. So speaking to someone on the phone is the best port of call for that. And if you're not sure of any details of any questions that they ask you, to speak to your healthcare team for further advice on that. And it's really important to kind of state all your medical conditions, not just myeloma. And that means, that they could declare your policy invalid if you fail to disclose any medical illnesses. So it's really important to read the details of the policy thoroughly and to check the cost of the insurance, the excess, exactly what's included and excluded in the policy, whether you're covered for any cancellations. If you bring any medical equipment, make sure that's covered, and that the policy covers any claims related to your myeloma as well. So just some general tips for traveling safely. So taking medicines at the right time, being on holiday can disrupt your kind of regular schedules. So to set phone or calendar reminders might be good to just prompt you to remember to take your medications at the right time. Going abroad, part of that is to try some of the local cuisines, and so that can kind of pose a risk in terms of eating or gut problems, particularly infections. So just to make sure you eat freshly prepared foods and avoid uncooked meats or seafood and unwashed salads. Staying hydrated, obviously very important, so to carry plenty of bottled water wherever you go, and managing fatigue as well. Although holidays are a great time to go and explore, it's important to remember your routine and plan some rest time as well, and doing activities that aren't too physically demanding. Very important. In our most recent version of Myeloma Matters, our magazine, we've got a travel checklist that can act as a guide for all things you may want to consider. It covers everything in this webinar and more, so I'd recommend you have a look at that as well. And just some patient quotes from the Myeloma Matters piece. So I'll focus on the last one there. So don't let myeloma hold you back. If you're well enough, do it. And we'd certainly agree with that as well. So thank you very much for listening, and I'll hand back to Fern.
Thanks so much, Rhys. That was really, really interesting. And I'm sure a lot of those tips will have helped everybody that's watching us today that wants to consider going abroad or traveling within the UK. So I'm just going to jump into the questions. So thank you so much to everybody who has submitted questions in advance. We received nearly 100 questions. So while we're unable to answer each one individually, we have grouped them by theme and selected the most common topics to address. So for any personal or specific health-related concerns, we do kindly ask that you contact your healthcare team directly. They're the people the best to give you the personalised advice that's most relevant to you and your situation. If you'd like to submit more, you can pop them in the Q&A box and we'll try our best to get through as many as possible. So without further ado, let's get started. So we've got a question here from Jeffrey. He is interested in finding out more about good recommendations for travel insurance.
Yeah, so we're not able to recommend any specific travel insurance companies or insurance brokers. But our travel insurance and myeloma info sheet lists all the travel insurance companies that kind of specialize in providing travel insurance for those with pre-existing medical conditions. So, we do very much recommend shopping around for insurance companies. Who you choose as an insurance provider should depend on who can provide you the best policy for your needs, and they're very much individual needs
Mhm.
there. So I'd recommend, yeah, shopping around and having a look at our info sheet for some of those companies.
Perfect, thank you. And I know it's mentioned on the slides as well, but definitely talking to a person is a lot easier than trying to fit myeloma into a drop-down box. Okay, so Dale asks, is it reasonable and advisable to request a course of antibiotics as a precaution from your healthcare team in advance of a trip abroad?
Yeah, I think that's very much depending on your own circumstances. So everyone has a different individual kind of infection risk based on some of the treatments they're on currently or have recently been on. And so it's very much worth having that conversation with your healthcare team.
Mm,
I think if you're on antibiotics or if you've been given antibiotics to take as a precaution if you do fall ill when you're traveling, just to be really clear about what situations you need to take
mhm.
those antibiotics and what situations you need to go and get some more medical support whilst you're out
Yeah,
there. So just having very clear lines of when you take them and when you need to seek more medical advice.
yeah, for sure. And making sure you know exactly how you're meant to take them, and anything to avoid while doing so. Um, so we've got a live question now from Judith, and Ken has commented about this as well, asking about hand washing and some general tips, for example, using gloves or a face mask. What kind of face mask is best, and any other sort of general tips about sort of keeping safe and clean while they're on holiday.
Yeah, I think to try and wash your hands as much as you can.
Hmm.
So if you're in a very busy area, just before eating, after eating, if you're touching a lot of things, it's really important to try and keep on top of the hand washing as much as possible. Using a face mask, I think just using not using the same one for too long.
Hmm.
If you've got your own one, you can wash, and if you've got facilities to wash that, then you can reuse it. But yeah, any disposable ones, as long as you're changing it regularly, would also be adequate.
Yeah, yeah, and having clean hands that you've just washed is just as good as having gloves. If you have your gloves on and you touch lots of things with your gloves, then it's not quite as safe as having nicely washed hands. So we'll move on to Nigel, who has asked, what sort of questions should I expect to be asked by a travel insurance company about his myeloma and his remission when he tries to arrange travel insurance?
Yeah, so travel insurers will be asking a lot of questions about myeloma and the treatment
Mm,
you've had or are having. And they'll also want to know just about your physical and mental health conditions outside of myeloma as well. So there's a lot of information that you need to give to them. I think if you're not sure of anything, then it's absolutely fine to ask your treating team
yeah.
about some of the questions that are asked. So just they're always on hand to give you that information if you need it.
Yeah, that's a really good idea. Go to your team. Thank you. We've got a live question now from Stephen. We always get asked about stage and the word terminal. How can we respond?
Yeah, so it's difficult with myeloma because it doesn't really follow the same patterns as a lot of other cancers. So the word terminal is very much reserved for if there are no treatment options left, whereas the vast majority of myeloma patients will have treatments available to them. So it's a really difficult one with regards to kind of terminal. Staging the same as well. So myeloma is a relapsing and remitting condition. And so trying to get that across is very difficult, especially when you're having to write that down, or there might not be an
Mm,
option to put that down on an online form, which is why we kind of suggest to speak to a person on the phone if that's possible.
yeah, and like you said, asking your medical team if they've got any more information about what their specific wording would be to describe your particular case can be really helpful. So another live question now from Will. I'm currently undergoing my first round of treatment for myeloma and I'm due a stem cell transplant in December. Is there any recommended period of time that I should avoid traveling, or is it advised on a patient by patient basis?
Yeah, so it can vary from patient to patient. I think, following a stem cell transplant, the healthcare team do keep a close eye on you for at least 3 months after
Mm,
the transplant. So they would probably suggest not to travel in that period just because you are
mm.
very vulnerable to infections around that time. But yeah, it's best if you're not sure just to ask your healthcare team as
Yeah,
well.
yeah, they'll be keeping a close eye on your bloods, and if they think that your bloods, your immune system isn't up to traveling and the risk of infection, then they'll sure let you know if that's the case. A question here from Gemma. Best tips for sun safety and also which sun creams are safe?
Yeah, so we can't recommend any specific sun cream brands, but
Mhm,
as I mentioned, having SPF 30 or above, making sure they're covered for all the UVs as well, and to check the expiry date of the sun cream. So the sun cream should be used within 12 to 24 months of opening the bottle. On top of the sun cream, there's other things that you can do to keep you safe from the sun. So keeping well hydrated, knowing the signs of sunburn, so redness,
mhm,
weeping, peeling of the skin. And if you do get sunburn, just to get out of the sun, don't pop any blisters if you have any, and talk to your healthcare team if you do have any concerns. So it's important, particularly in myeloma, because some of the chemotherapy or radiotherapy therapy treatments means your skin will be more sensitive to sun damage. So it's really important. So I haven't got any sun cream in particular that I can recommend, but yeah, important that it's SPF 30 or above for sure.
Yeah, great, thank you. Another live question. It says that some holiday destinations further afield ask for vaccinations that are live. Is it best to just avoid those destinations?
Yeah, so as a general rule of thumb, myeloma patients generally we avoid giving live vaccines. That's just because the immune system is suppressed, and giving a live vaccine can actually give you the
Mm,
illness that the vaccine is trying to protect you from. It's very much still a case by case
mhm.
basis. But speaking to your team about the destination, making sure you've got the up-to-date list of vaccinations that's required for that destination is very important.
Yeah, perfect. And related to that, from Matthew, it says, I am 12 months post stem cell transplant and need to have my childhood immunizations. Would you advise waiting to travel abroad until these are completed?
Yeah, that's a good question.
Mm,
Um, so I'm not entirely sure. I think again, speaking to your medical team
mhm.
might be a good way to go with that. I'm not sure about that one. I'm sorry.
Yeah, I definitely think speaking to your medical team and just seeing which immunizations you can have at which point. We have it listed in our vaccines info guide, sort of a table of when people should have the immunizations post a stem cell transplant. And yeah, speaking to your team to think just to see if they think that you're at risk of any of those infections and if you should avoid going to certain countries that are more high risk. Um, so a question here from Audrey. When in remission and either on maintenance treatment or not, are we still categorized as having myeloma?
So, unfortunately, yes. So, myeloma is a relapsing and remitting cancer. So, you will still be categorized as having myeloma, and that will, have an effect on your insurance premiums. So, it's really important to tell your insurance company about your myeloma and any other health conditions as well. As I said in the presentation, if you don't disclose all of your medical so
Mhm.
yes, unfortunately, you will still need to be telling them that you've got myeloma in that scenario.
Sure. Okay, thank you. Another live question here, who's from John. and says, how far abroad can you go? Just Europe or further?
So not just Europe, so you can go to other countries as well. It's more down to kind of the vaccinations really. That's the biggest thing that might limit your travel to
Mm,
certain areas outside of Europe. So I wouldn't say it's just Europe. Obviously, with going further afield, then your flights will be long haul flights as well.
mhm.
So that discussion with your healthcare team about the risk of blood clots needs to be discussed, and whether they put you on medication to thin your blood just for that time that you're traveling. That needs to be considered when you're going further afield from just Europe.
Yeah, great, thank you. And then Abigail asks, is it safe to take malaria tablets?
Yeah, so this is a very much depends on kind of what treatments you're on or what treatments you've had, because sometimes the treatments can interact with the malaria tablets. But it's very much depending on what treatments you've had. So again, speaking to your healthcare team, explaining your plans and saying,
Mhm.
do these malaria tablets, will they interact with the medications I've taken or are taking
Yeah,
currently? Just to make doubly sure that it's safe to take those tablets.
yeah, that's great. And not just with myeloma treatment as well. There's, a whole host of treatments that it can interact with. So just make definitely sure you've covered all grounds. Bob asks, when traveling with drugs, do I need to have them in their original boxes?
Yeah, so we do recommend that you carry your prescription, a copy of your prescription, and to have the medications in their original packaging
Mhm.
as well. And we know that some of the treatments that can be quite bulky and inconvenient to carry, but it just makes it less likely that you face any issues when you're crossing borders if they're in their original packaging. So yeah, so as much as they are quite unwieldy,
Mhm.
and there's quite a lot of boxes, it's safer to carry them in those original boxes. Yes.
Yeah, and definitely try and keep them in your hand luggage as well if you can, because you don't want your case getting lost with all your tablets in. So another live question here. I'm thinking of going on a cruise. I'm aware that this involves being in close proximity to lots of other people. Obviously, I do my best to keep as far away from others as possible. At worst case, there is always a doctor or hospital on board. Would you recommend not to cruise?
So as long as you're keeping safe and doing those precautions, and
Mm,
I think it's I wouldn't say don't cruise, and I think that is something if you're keeping your distance and kind of following a lot of the COVID kind of lockdown rules in that you're keeping a good distance, you're washing your hands
yeah.
regularly, you're wearing a mask when it's appropriate, so. But if you do have any problems on board and you think you might have caught an infection, then obviously to consult the doctor on board as well. So yeah, the cruise is definitely not out of the question
Mm.
for sure.
Yeah, hear of lots of people that ring us that are going on cruises. But yeah, all those precautions sound like a really good idea. A live question from Kevin. Is there any foods or drinks that you should avoid before flying?
So no, not particularly before
Mm,
flying. I guess it's just about keeping as vigilant before you fly as you
mm,
would when you're out there on holiday. So avoiding uncooked meats and making sure that you're not eating anything that you wouldn't normally
mhm,
kind of eat before you fly. The worst thing you want to do is get food poisoning just before you fly.
mhm.
And once you're out there, just being very vigilant of what you're eating, making sure that keep that vigilance abroad as well. So there's no food or drinks that you should avoid specifically. It's just about being vigilant, at all times.
Yeah, sure. Thank you. A live question from Jill. You've mentioned blood clots a few times. Does myeloma make you more at risk?
So yes, so having myeloma does increase your risk of getting blood clots, unfortunately. But that doesn't mean that you need to be on blood thinning medication at all times. It's very much depending on individual risk. But it's worth speaking to your healthcare team if you're going on flights to see if there's any medications that you need to take before taking the flights, and doing things like taking regular walks whilst you're on the plane. That's really, really important as well.
Yeah, that's great. Thank you. So a live question here from Sarah. Sarah, do people with myeloma travel off-piste, so more adventurous trips, or do they mainly go on package or organized trips? And then related from Scott says, do many myeloma patients go skiing? He's 60 days post stem cell transplant and is looking to head in the winter.
Yeah, this is a good question.
Hmm.
I guess I'm not entirely sure of the overall kind of numbers and what holidays
Hmm.
people tend to go on. I don't know, Fern, if you've got a bit more experience given you're on the info line.
Yeah, I've had people tell me they're going to all sorts of places. It's just the same thing, just being careful, following what feels right to you, talking to your medical team, make sure you've got all your precautions, you've got enough medication to cover, enough treatment to cover potential delays, things like that. And, skiing, I guess you just have to be careful if you're at risk of fractures, if you've got myeloma bone disease. And again, your medical team, I know we've mentioned that a lot, but your medical team will be the best people to know you and know what's safe for you. And they'll be very, very used to having these questions, and they should be very, very helpful in sort of getting you to a nice destination and getting a nice something nice to look forward to. So we've got another live question from Justine, who says, having myeloma, do you have to be more careful about insect bites?
Yeah, I certainly think you need to be more vigilant. Wearing insect spray if you can to avoid getting bitten. I think it's very important. Obviously, myeloma leads to a suppression of the immune system, so you are more likely to get infections from the bites as well. So just
Mm.
being really aware of whether you've been bitten and keeping an eye out for that bite, just to make sure it's not getting bigger. The redness is spreading up and down around where you've been bitten. Obviously, if you're starting to feel symptoms like fevers, and you're really worried about the bite developing and giving you an infection, then that's when you need to consult a healthcare provider kind of locally at your travel destination.
That's great, thank you. So another live question here from Ken. Do you recommend you bring Purell, so it's like antibac wipes to clean surfaces in the hotel rooms or airplane trays and seats when traveling?
Um, I think that's a good idea, and it certainly, for the airplane trays and things, it's a good idea, but not to kind of take it to the point where you're not
Hmm.
enjoying your holiday because you're so
Yeah,
worried about infection. So it's about kind of having a relaxing, enjoyable time whilst you're traveling, whilst also trying to keep things as clean as possible. So it's yeah, everyone will have their own kind of individual ways to counteract that. But I think to do that would be a good idea, but as long as it doesn't detract from your
yeah.
experience of traveling.
Yeah, and if it's going to make you feel a bit safer and make you be able to relax a bit
Mm.
more, then I guess that's, if it's going to help you, then you're avoiding infections that way as well. So a question here from Jill, who says, when on the plane, is it best to have the aircon above you to help move the airflow? Do you know? Also, whether a mask is helpful to wear throughout. Not heard about the aircon.
No,
Um,
I'm not sure about the aircon, to
mhm,
be completely honest. I'm sorry about that. And wearing the mask throughout. I mean, a plane is a very, very packed place,
mhm,
and people can bring in infections into that space. And so, wearing a mask when it's possible
mhm.
during the flight, then I think that's a really good idea.
Yeah, yeah, definitely. But make sure you're able to keep your fluids up and you are eating when you can. Perfect. Is there any more questions that anybody has that haven't been answered already? So there's one here about prescriptions. Does the NHS app listing my medications count as proof?
That's a good question.
Yeah,
Um,
I think it could depend on the sort of TSA agent that you get, whether, what they'll accept as proof. I
yeah,
think it's always safest maybe ask your medical team for a list of your medications and, a printout of the prescription if they can, if you don't have one. Um,
yeah. I think having a list, yeah, from
yeah,
your healthcare provider is probably better than using the app. You know, is what I'd say.
yeah, yeah. Different countries might not recognize it. It's also, you might get them there, but coming back again. You want to make sure that it's all safe. Keith asks, is it okay to eat cooked seafood?
So yeah, there shouldn't be an issue with eating seafood that's cooked.
Hmm.
As long as it's cooked, properly. I think there shouldn't be any issues with that. And of course, part of traveling is to try the local cuisine. And as long as you're doing that and being vigilant and safe in doing that, eating cooked seafood, I don't see an issue with that.
Yeah, yeah, unless your medical team have told you that you should, eat a clean diet or a neutropenic diet, they sometimes say, which will say to us to avoid shellfish in general because of the infection risk. But unless you've been told otherwise, then well-cooked food should be good. Judy has asked, is COVID still an issue?
So with regards to kind of traveling and
Traveling, yeah, I think
yeah. And
um
make Yeah, so we'd recommend taking a COVID vaccine, still taking
mm,
vaccines. In terms of COVID still being an issue from personal experience, I don't think you need evidence of a COVID vaccination when you're traveling
mm,
now. Um, so I guess, yeah, just making sure that you're up to date with all the vaccines that you can take. And yeah, I guess COVID is something that isn't really reported
mm,
on as much these days. So
yeah.
people aren't as or countries aren't as keen on you having the COVID vaccines to travel like
Hmm.
they used to. I
Yeah.
guess.
Yeah, and you can always check the government website lists, any infections that are currently in that country that you should be majorly aware of, and the COVID risks sort of throughout the countries. Um, Graham has asked, if you contract an infection while abroad, what's the best way of finding out where to go for help?
Yeah. So um, that's a really good question.
Yeah, sometimes places will have tourist information that you can go to, or if you're in a hotel, the hotel reception might be able to direct you to somewhere. Or if you know where the local hospital is, even if you don't think you need the hospital, they'll be able to direct you to somewhere that's safe. Or if you see perhaps a pharmacy, quite often when you go abroad, they'll all have the flashing green crosses while you're walking down the road. Um, so perhaps pop in there
Yeah.
and see if they can help out just to direct you, really.
Yeah, and I guess if you know where you're staying
Hmm.
if you've got Google Maps or you can open maps on your computer just to
Yeah,
see where the local hospitals are in relation to where you're staying before you go as
yeah,
as well. And
yeah,
um, yeah,
yeah, that's a great idea. So that's all of our questions. Thank you very much to everybody that submitted them. I really appreciate it. Um, and please remember that we are here to support and offer as many services as we can where you can speak to someone who understands. Um, so yeah, thanks, Rhys, for answering those questions as well.
so
So, as well as the info packs and the info sheets that have been mentioned in the chat, we also have a range of publications that you can download from our website, or you can order hard copies. All our previous Digital Infoday sessions are up on our website and our YouTube channel, where you can watch them on demand. So we have our Peer Buddy service as well, which provides the chance for you to tap into the knowledge and experience of others, perhaps people that have travelled with myeloma before. You can ask them questions, and that's in a one-to-one setting. We also run in-person info days across the UK, and they're going to be in September, October, and November, the next ones this year. So please check the link that's been added to the chat to learn more if you'd like to attend. Our next in-person event is going to take place on Saturday, the 6th of September, and that's in London. So lastly, we have a range of support groups all over the UK where you can meet other patients, carers, and family members. Myeloma is a very individual cancer, but you don't have to go through it alone. There are lots of ways to connect with others who know what you're going through. So we're coming to the end of our event today. Our thanks go to Rhys for speaking to us this evening, and we'd also like to thank everyone who's joined us tonight. And we hope that you found it helpful and informative. If we didn't answer your question tonight or the event has prompted some new questions, please contact us. You can do this via our info line or Ask the Nurse email service, and our contact details are on the screen now. They can also be found on our website as well. And just to let you know that we are experiencing some technical issues with our info line currently. So callers are getting an engaged tone when they call the 0800 number. And I do apologise if that's something that you've experienced, but please do try calling our mainline number, which is 0131 557 3332, and it'll give you a range of options, and the info line is option 2. And this is under investigation, and we do hope to have it resolved as soon as possible. So thanks to our supporters, Myeloma UK can provide free digital events just like this one for patients and their families. However you choose to support us, your generosity will help change the lives of people living with myeloma and their families. Once again, I'd like to thank you for joining us, and I hope you enjoy the rest of your evening. Good night.